Hi everyone, I am Dr. Rahul Gupta, Senior Interventional Cardiologist at Apollo Hospitals, Mumbai with clinic in Navi Mumbai as well as at Doctor's House, Pedder Road in Mumbai. Today I am going to talk to you about high blood pressure, which is also called as hypertension, and how hypertension is related to heart diseases or heart attacks. So whenever the blood pressure in the body increases, it is called as hypertension. Normal blood pressure is around 120 by 80, and when the pressure gets elevated more than this, we have different classifications. So initially up till 130 it is called as elevated blood pressure. More than 130 up to 140 is called as grade 1 hypertension, and more than 140 is called as grade 2 hypertension. So these are the severity of the hypertension by the latest classification of high blood pressure. And this high blood pressure, whenever the pressure increases in the body, all the organs are subjected to high amount of pressure, and which causes them to get damaged. Similarly, like for example, if the heart has to pump very hard against the high blood pressure, so it can get thick, and the arteries of the heart also are exposed to high blood pressure, and they can have wear and tear, which after which there can be deposition of the cholesterol and can increase the chances of development of blockages. Similarly, the other organs of the bodies like kidneys, the brains, the arteries, major arteries like the arteries which supply the legs also, they can also get impacted through high blood pressure, and the blockages can develop into these arteries, leading to the damage to that particular organ. So if the kidneys are affected, it causes kidney damage. The eyes can also get affected, it causes retinopathy or decreased vision. And there can be a stroke also, because the same blood supply which goes to the brain, the same arteries can also get impacted by the high blood pressure. Now coming to high blood pressure and heart attack, the high blood pressure will cause the damage into the arteries which supply the heart. The blockages can develop, and if the blockages can become severe, they can cause symptoms of chest discomfort, angina, and if there is a rupture in the plaque, suppose for example when we get a cut anywhere in the body, the blood oozes out and forms the clot. Similarly, patients who have got blockages, and if there is a crack in that blockages, the blood oozes out and suddenly it obstructs the entire blood supply and causes a heart attack. So high blood pressure is not only related to causing heart damage, but all the other organs, it can cause damage, as I told you, the kidneys, the brains, the eyes, the peripheral vascular disease, that means the ulcers in the lower leg, which can lead to amputation. So high blood pressure needs treatment. High blood pressure is like a silent killer, because most of the time we think that, if I have high blood pressure, I should get headache, but that's a myth. Most of the time we don't get any kind of symptoms, and therefore we neglect taking treatment for that. So it is my urge to everybody that, if you are adult, you should continue to check your blood pressure as and when you get the opportunity, at least once in a year. And if you are found to be having hypertension or high blood pressure, please take treatment. Treatment can begin in form of natural treatment, reducing the salt, taking care of other parts of your diet, exercise, proper sleep, reducing stress, yoga, meditation, and pranayama. And if that is also not helping, then taking medication is extremely important. So just don't rely on the symptoms, because it's a silent killer and it is continuously damaging your body if your pressure is on the higher side. So I hope you understand.